I like it.
I saw your flag earlier, Dave.
Hey, everyone, I'm just trying to get this meeting back on YouTube for a second. There was some reason it dropped, so just give me a minute.
Okay.
It's back on now.
I was gonna say, Michelle, it is showing on my screen that it says live on YouTube.
You're live.
All right. I think we should have everybody here from what it looks like. It is 12:01, so I want to call the Health and Human Services meeting to order this morning. And first thing we'd be looking for is a approval of the agenda. I think everybody is muted, so I don't, my screen's not popping up, so I don't know if anybody has said or offered a motion in support to approve the agenda.
I'll make a motion.
Move that we approve the agenda.
Support.
All right, it's been moved and supported. Everybody in favor, say aye. Again, I can't see many screens yet.
Aye.
It seems like I don't know if the computer or what.
Aye.
All right. All opposed, the same. Okay, next item on the agenda is public comment. Michelle, do we have anybody waiting for public comment?
No public comment.
Okay, so that would move us to the committee items. Item A is we would need a motion and support to approve the minutes from our April 13th meeting. Sounds like they've been moved. Again, I can't say, I don't know why, but I'm not seeing any
Support.
Any screen. Okay, I hear support. All in favor, say aye.
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 Aye. Aye.
All opposed, the same. All right, thank you very much. Next item on the agenda are our appointments. First item for appointments we have is Veterans Affairs, Public Representative. The term expires 3/24. The seat is currently vacant. We don't have any applicants for the seat. Are there any nominations from the floor? Okay, so we'll leave that open. The next is the entire Sanitary Code Board of Appeals is open. Well driller, alternate licensed sewage system installer, an alternate seat, public seat, commissioner seat, and an alternate commissioner seat. It's currently completely vacant and no applicants. Anybody interested in that seat or nominating someone to that seat? Okay, so we'll leave that one vacant for now as well. And then the MALPH board, we actually filled that last month. As I volunteered for that one. So we actually filled that at the last meeting. So that takes care of our nominations for appointments. If you take a look on there, it does show at the bottom that we do have we have no appointments coming up for next month, but there are a couple other boards on our other committees that are coming up for next month, in case anybody is interested. Next, we have the Lifeways monthly report. Is someone on from Lifeways?
Can you hear me? This is Karen Cascadden.
Hi, Karen.
Thank you. Hi, Daniel. It's nice to see you. Mary Beth Leonard is trying to connect right now. She may have just connected. I think I just saw her join the meeting. I'll mute so that Mary Beth can speak.
Okay, I can see Mary Beth. It does look like she's muted. I don't know if Michelle needs to unmute her or give her the ability to unmute, or
Yeah,
she might need
Karen.
to unmute herself.
Karen, you were speaking under Mary Beth's name. So is Mary Beth logged in under Destiny?
Oh, maybe that is why she cannot connect.
No, Destiny's on the line as well for medical care facility.
Yeah.
Yeah.
Okay.
I'm here.
So you're logged in with Mary Beth's registration. She can't log in. You can't share it. You have to register on your own. That's why she can't log in.
Okay, we were both using the link that Delane sent. I'm going to log out and ask that you delay her report shortly, and so that she can log in.
Okay, we'll move forward to item D, medical care facility report, and then we'll come back.
Hello, everyone. This is Destiny Wilkins from the Medical Care Facility Administrator. I have sent 2 copies of the report, one from March 9th when I was asked to report, but unfortunately I was ill, and then some follow-up from our most recent board meeting. Would you prefer that I read through the report, or would you like to ask questions first? What would your preference be?
What's the pleasure of the committee?
We can go through your report and then we can ask questions as we go along. I think might be the easier route.
Okay. So just going through the financial status. So for November of 2019, financials for November show a net loss of $31,000. This has beat budget by $499,000 as the facility had budgeted for a net loss of $480,000 for the month of November. This is mainly attributed to higher than budgeted census, resulting in $152,000 of revenue better than budget. Expenses were also under budget by $297,000. Census averaged 185, which was 4 beds over budget for November. For December, financials show a net loss of $468,000. This is below budget by $578,000 as the facility had budgeted a net gain of $110,000 for the month of December. Revenue was $124,000 behind budget. Expenses for December were $454,000 over budget. This is mainly attributed to higher than budgeted expenses for wages for multiple departments, in addition to higher than budgeted QAS and QMI expenses. So QAS is our quality assurance supplement, which is a bed tax that we're required to pay. All nursing home providers are. And QMI stands for quality measure incentive, which is also a tax that we're required to pay to the state. And what happens in December is that last, the state fiscal year starts over in October, they do some adjustments to make sure that the tax revenue met what was needed. And they do adjustments for that next invoice that they send to us as providers for any shortfalls. So if any facilities in the state of Michigan fail to pay their bed tax according to what they were invoiced, all of the other facilities are required to chip in additional money to cover that shortfall. And that's where some of that came from. And then census averaged 184 with 3 beds better than budget for December. Did I have somebody that had a question on that?
Mr. Chair, when I look at the board agenda, I see financials for January, February, and March. Am I looking at the right thing?
Yes, you are. I was going to ask the same thing. I'm not sure where the December financial numbers that you're speaking to, Destiny. Only items that we have is we've got January, February, and March financial statements, and then we have your report. We're not seeing anything from December.
Okay, I'm sorry. That was in the quarterly report that was submitted for the March meeting. I do have the January, February, and March financials as well. I just wanted to go through the whole continuum, but if you just want me to focus on January, February, and March, that is just fine with me.
Well, I think that's good for you to speak to. We just don't have that document in this month's packet.
Okay, I apologize.
Is the issue.
Mr. Chair,
I can proceed with January. January financials show a net loss of $165,000. This is above budget by $116,000 as the facility had budgeted for a net loss of $49,000 for the month of January. This is mainly attributed to higher than budgeted Medicaid census and a lower than budgeted Medicare census, resulting in a revenue $21,000 behind budget. Expenses were over budget by $95,000. A majority of this can be attributed to nursing wages. Census averaged 183, which was one bed under budget for January. For February, the financials for February show a net loss of $199,000. This is above budget by $32,000 as the facility had budgeted for a net loss of $167,000 for the month of February. The revenue exceeded the budget by $3,000. Expenses were over budget by $37,000, and this can be attributed to nursing wages and an increase in pharmacy costs due to the need to treat the building prophylactically for influenza. The census averaged 186, which is 2 beds better than budget. And for March, financials for March show a net loss of $128,000. This is above budget by $79,000. As the facility had budgeted for a net loss of $49,000 for the month of March. Revenue was under budget by $3,000. Expenses were over budget by $76,000, and this can be again attributed to nursing wages and an increase in pharmacy costs due to change in medication for one Medicare resident, resulting in cost to the facility. The average census was 184, which was at budget. So that is the financial side for January, February, and March. On the people side, we have a year-to-date turnover rate of 9.66%, with January having 8 departures and 12 new care partners, February having, at the time that this was written, 0 departures and 5 new care partners. Our mandation overall has been down from previous months, has been staying pretty steady between 1 to 2 mandations a month for both CNAs and nurses, total, not per CNA and nurse rather. And our quality, we continue to rank as a 3-star in quality. We have 5 stars in staffing, in the staffing component of the CMS 5-star system. We continue to meet monthly for quality improvement projects, including long-term use of Coumadin, fall rate tracking and trending, transfers, and auditing the use of mechanical lifts, medication pass audits, dining room observations, kitchen and food prep audits, auditing our medication and treatment records, call light timing, and informed consents for anti-anxiety and antidepressant medication. Also, in the report that you received in this packet, you will see an outline on page 2 of our COVID-19 response. And I'm just going to review that quickly. March 10th, we began changing our visitation hours. By March 12th, we were closed to all visitors with the doors being locked and no deliveries into the building. We also began screening all of our care partners, and laundry began laundering all of residents' personal items. Up until that point, we had some families that would choose to do their loved ones' laundry at home rather than having the facility do that. March 14th, we shut down the main dining room and limited activities and dining to be on each of our individual units or neighborhoods. March 16th, we further limited group activities to only be done in the hallway and to be socially distant, and limited out-of-room dining for those that have challenges with eating safely only. Business office and HR personnel were sent home to work remotely. We implemented social distancing in the break rooms for care partners, established email addresses for families, All new readmissions and admissions have to remain in our renewal center, which is our new renovated area, on the lower level for 14 days upon admission, to quarantine them to make sure that if they had been exposed to COVID-19, that they wouldn't be bringing that into the building. As of March 20th, care partners were no longer allowed to leave the facility grounds once their shift started, and no food deliveries were to be made to the facility. Dietary was providing meals for all shifts. March 23rd, all care partners received a letter for them to carry with them indicating they were essential worker. March 30th, every care partner began wearing a cloth mask. On March 31st, we established the dialysis den, which is a specialized area for our dialysis residents, as they are at the highest risk for exposure to COVID because they continue to go out into the community for dialysis. So they have a dedicated area and a dedicated staff member that works with them to help make sure that we protect them and protect all of the other residents if they could potentially be exposed. On April 2nd, we canceled all vacations longer than 1 day. On April 13th, every care partner transitioned from cloth masks into surgical masks. And since the writing of this report, to date, we have 20 residents that have all tested negative for COVID-19. 17 care partners have been tested. 13 of them have been negative. We have 3 pending today. And we had 1 positive case that was reported to us of a care partner yesterday, and that care partner has been out of the building since April 26th, or April 27th rather, due to the potential exposure that they had in the community. So we believe our risk is fairly low on that. And that concludes my report. Any questions I can answer for you?
Thank you very much, Destiny. I'm sure we definitely have some questions, especially in regards to the financials. Mr. Pileski, Commissioner Pileski, I just saw your hand go up.
Yes, Mr. Chair, I've got a couple of questions. And first of all, I think the fact that we've been able to keep the facility virus-free is remarkable and commendable. I would simply note that in advance of my financial related questions. With respect to being under budget so far this year, and largely that's a personnel related cost, I'm kind of assuming that that's not going to reverse itself during the current fiscal year, and that those personnel costs are a result of the virus. Would that be a fair statement?
Well, some of those costs are related to call-offs due to the virus, but prior to January and February, those costs would not have been attributed to that.
So is the philosophy there when we're off budget, as we appear to be, do you look to update with a forecast of what the year might look like, and I guess more importantly, what our actions might be to deal with the fact that the forecast may be not as good as we had originally hoped?
So one of the things that we've been doing right along is assessing overtime rates and whether the overtime rates have impacted those wages that we are putting out. Based on a look at January and February, those overtime rates were in line with what we had budgeted. March, we're seeing an increase in overtime, which that could be attributed to the virus, but we're also looking at the quality of our data. Just because our payroll system, this has been a long time challenge where sometimes we question the data that we're getting from our payroll system. And we've been working on transitioning to a new payroll system. But that's one of the areas that David from Lally Group, who is our accountant, and I have been digging into each of the individual people and what bucket that they've been put into the budget to make sure that they're being budgeted in the correct budget. But ultimately, if you're over on wages overall, it's not necessarily a bucket issue. We did look at some additionally at the rate of pay and the average rate of pay and FTEs to determine if that has changed significantly since October when the budgets first began being created. And so we're looking at that piece of it to see if that can help remedy it. We have also left some positions unfilled in an attempt to kind of balance things back out. So typically we have about 320 care partners. Right now we have 303. But at the same time, when you offset it by people, sometimes you increase it on the overtime side. And that's the other piece that we're trying to make sure that we're finding the happy medium in between. And I'm not sure that we've reached that quite yet.
I've got just one more question, Mr. Chair, and thank you for your indulgence. I had addressed a question this morning, I think, to Deb and to Cecilia Anderson. I apologize, Destiny. I didn't know that I probably should have addressed it to you. It relates to the balance sheet and the 3 months that we see here. The equity in the balance sheet has moved around. The numbers have changed by significant amounts that are not accounted for by the annual or by the monthly income or loss. And also I see the long-term liabilities from February to March have changed by $7 million. And unless you issued new bonds or something, I can't imagine that occurring. I don't know that there's an answer for it today, but I do hope that we can arrive at answers on the balance sheet in due course.
So
I don't know if Deb or
Mr.
anybody else has observations on that, but that's all I have, Mr. Chair.
I do have some answer on that. Deborah was wonderful enough to send your question over to me. So most of this variance, not all, but most of this variance has to do with OPEB adjustments from the 2019 audit, because what you're looking at is just a point in time. But as those adjustments are being allocated, you're seeing the difference in the equity and the liabilities, is the answer that I got from David from Lally Group regarding that. And he said that that doesn't account for all of it, but it does account for a bulk of that change with those OPEB adjustments, which can be quite large.
Well, and thank you, Mr. Chair. I'm sure this is not a discussion the rest of the committee wants to have, but we can address this in the oncoming month. Thank you, Destiny. I appreciate it.
Wonderful. Thank you.
Are there any other questions for Destiny today? Commissioner Kennedy and then Commissioner Williams.
Hi, Destiny. How are you doing?
Good, thank you. How are you?
I'm all right. So looking at the three financials that we got, and you mentioned it, nursing is obviously the major cost that's putting us over budget. Is there anyone addressing that schedule-wise? I know you had mentioned that there's some overtime getting put out. Is there anyone in charge of that, trying to get that labor cost down to the budgeted amount?
Yes, so we've met with our scheduler who schedules nursing and discussed looking at the individuals who have the tendency to have the most overtime and those individuals that have a tendency to work double shifts. So for us, our overtime rule is anything over 80 or anything over 8 in a day. So if somebody decides to work a double shift for us, they're automatically getting 8 hours of overtime. So we started with those individuals that aren't necessarily working a full schedule, but then they choose to work double shifts, which though that might fill our scheduling need, the premium that it charges for the overtime rate overcomes the good it does by covering the schedule. So we started with those individuals and then started to look at our high overtime usage individuals that tend to do a lot of overtime work to monitor their schedules more closely.
Okay, so let me ask you this. I would assume for anybody to do that, they can't just take it upon themselves, that there's some supervisor they'd have to get approval to work a double shift. Am I correct?
That is correct.
Okay. And are we stressing with our supervisors that we shouldn't do that unless it's an absolute emergency situation?
Yes. Yes, we have been.
Okay. Thank you.
You're welcome.
Commissioner Williams?
Thank you. So I just have just one question. I know we've talked a little bit about some of the financials, or all of the financials, and so we definitely have some things we need to keep our eyes looked out on. But on top of that, I noted that you mentioned that quality is down to a 3-star. Is there anything that we're currently doing or working on to raise that standard?
So one of the things with the quality measures is every time, so it's set on a bell curve, first of all, for the state. And every time that people's quality measures increase to a point that there's too many people in that 5-star level rating, they recalibrate the 5-star rating system for quality. So what used to be a 5-star is now a 4-star or is now a 3-star because of the recalibration that they're doing to try and increase quality overall. Now, one of the things that we do every month is that we look at anybody that is causing one of those quality measures to trigger in a negative way. And so we look at that individual, we go back through their medical record to make sure that there wasn't an error in the coding of the MDS assessment, which is what determines the quality measures. We also have ongoing quality projects to address those concerns. So for instance, if a resident has a catheter in without one of two specific diagnosis codes, that counts against our quality. Even if their urologist continues to say that this is needed for them, if it doesn't fall under one of those 2 diagnosis codes, it counts against us. But one of the things that we've been doing is really focusing on making sure that we specifically ask if any of those diagnosis codes apply to them, just because even though physicians diagnose, they're not always accustomed to those particular diagnosis codes that impact us. And so they might have a diagnosis code that works for what their billing is doing, but it can still impact us negatively, if that makes sense. So just trying to summarize it down a little bit with a more simple one. The other ones that we look at, UTIs or urinary tract infections is another area that we're constantly looking at and addressing with education with our staff to make sure that they're using proper technique. But these are things in older adults, dehydration, that there can be an increase in just as an older adult with comorbidities. So we look at all of those individuals that are triggering for those quality measures and work quality projects around those to try and increase our star rating. Our star rating was at 4 stars and then they recalibrated again and we've slipped back down to that 3-star status, but we continue to work on that constantly because we really don't feel like that's an adequate view of the quality that we present to the community.
Okay, I see. Okay, so yeah, like I mentioned earlier, on top of the financial positions we're in, we definitely want to make sure that we're taking or continuing to keep a good eye on the numbers. I'm curious to see what things will continue to look like on next month with these numbers, but nevertheless, I do thank you for your service. I know that with everything going on, you certainly have seen some very challenging things, and you're doing the best that you can with what you got. So we thank you for that. And as you continue to serve the citizens of Jackson County. Thank you so much.
Thank you very much.
Any other questions for Destiny? Destiny, I think pretty much all the questions that I had have already been asked. And I will echo Commissioner Williams in saying thank you for the service and the job that you've done, especially with the COVID-19 situation. And we will definitely look forward to hearing back on some of those financial questions that we have in regards to the budget and there. And I'm sure some more questions may arise, but again, we thank you for coming today and presenting. And I think that will conclude unless you have any other comments or anything for us.
No, I think that's it for us. Thank you so much.
All right, thank you very much. Okay, that brings us down to Department on Aging 2020 monthly report.
Good afternoon, commissioners. Am I coming through okay?
You are,
Okay.
and I'm sorry, actually, I got to take that back. I'm sorry, I gotta jump back up. I forgot we
That's
skipped
fine. All right.
I do see Mary Beth on, so we're gonna skip back up to Lifeway real quick. I'm so sorry.
All right, this is Mary Beth. Can you hear me?
Yep.
Okay, I see people shaking their heads. Okay, great. Well, good afternoon, commissioners. So I am presenting for the report for this month. First thing I'd like to include, it's not in the report because this report was done on April 24th, and there's been some significant things that have changed since the report was developed, but did want to kind of give you an update about how it looks relative to COVID cases at the community mental health. We have a total of 9 cases. 3 of them are at the state psychiatric facility. They're not actually here locally. 3 are in our Hillsdale area relative to the medical care facility. And then 3 additional ones are individuals that live independently. I am happy to report that at this point in time, we still, and I'm keeping my fingers crossed, that we do not have any cases in our residential settings. I think our organization, when we heard back in March, we quickly came together as an executive team, a leadership team, to plan for how to protect those that we serve, and immediately put into play practices within our residential settings to mitigate individuals visiting the home unless it was an essential service. And I think that that has contributed greatly to not seeing some of what I'm hearing even with my colleagues across the state. So we are planning, however, and you'll see that in the report, for in the event that we did have a situation in which one of our group homes had an outbreak of COVID. We do have a 12-bed adult foster care home identified, and a provider that would be able to provide the residential services on site. And we've worked with the local health department to be able to provide training for staff around infection control, specifically around COVID, should that occur. But I am again happy to report that we have not had to do that. The other thing that's happened since we met last is that some of the federal CARES Act funding did come to the community mental health across the state of Michigan. It was only, say only, but there was a lot of funding in the CARES Act, as you know, $5 million that went to the mental health system across the state of Michigan. They did a calculation, and for us locally, that's about 133,000. And it really is being utilized to be able to implement the telehealth services that we have in play. It's important to note, should you hear Lifeways is providing services, we have not stopped providing services. The only services in which we did temporarily suspend are those services that are more large group activities, clubhouse programs, things of that nature, where there's lots of groups of individuals getting together. Other than that, all other services are still occurring, and 24/7 crisis JCAN sent out, we provided last week a one-page flyer that kind of outlines all of the different types of hotlines, call centers that are available for individuals. During the course of this pandemic, the governor has passed 2 opportunities for additional call centers, if you will. There's a statewide call center as well as a peer support hotline that has created some confusion, as there's already a local hotline for community mental health. And there's also national numbers. What I just want to assure you of is that regardless of where somebody accesses a hotline for mental health, whether that is a national number, a statewide number, or our local 1-800 number, they are referred back to the local community mental health to access care. So just be aware of that in the event that you get any questions about how to access mental health services 24/7. The other thing that's included in your packet, there's been a lot of activity by Lifeway staff to really get out there opportunities to support our community around mental health. The ability to have things like groups available online, teaching people how to do mindfulness and coping strategies, how to talk to your kids about what's occurring with COVID. All of that is available on our social media platforms, so feel free to refer people there if you know anybody. The other thing that we're anticipating, and I'm just now starting to see it occur, is that the impact of this pandemic isn't just going to impact our community right now from a mental health perspective, but it's the long-term concern and impact. And I'm now starting to see it. So you'll in your handout, you have the data around the calls coming in to our crisis line, the 24/7. And initially we weren't necessarily seeing an increase in those calls. Since this report, the average has gone from about 25 to 23 calls a day. Now it's up to 47. And I anticipate, just like other types of events that occur in a community, whether it's a natural disaster, if you look at the data around the impact of that on a community from a mental health perspective, it goes years after. So we can anticipate that there's going to be an increase in our community around the needs for mental health. And just wanted you to be aware of what we're seeing at Lifeways at this point in time. The other thing that's occurring, like many organizations, is that we're trying to develop our plan relative to phasing back to work. As the majority of staff are working remotely and doing services via telehealth, the need to bring back and do face-to-face, but do it in such a way that it protects those that we serve and our staff. We do have a phased 4-tiered phase plan that we're working on. Right now, it is with the health department. We've asked for their review and to provide some feedback about any ideas that they might have relative to our plan. And again, it is a lot of it is contingent on what actually is happening locally, what the numbers look like relative to the prevalence of COVID, what the recommendations are from the state of Michigan and the CDC. So as you can imagine, there's lots of parts to this plan and lots of potential opportunities for us to make sure that it's very fluid as we move forward. The other thing that I would like to share, and it's quite, it's a proud moment as a as a community mental health, and it should be something for the county commissioners as well, is that our Jackson County jail clinician, our mental health clinician, who's been at the jail on behalf of the millage that we passed, she was actually nominated for the civilian award. She's not an employee of the sheriff's department, but she was nominated for that. And it speaks volumes to the work that's been done relative to putting mental health supports in our jails. So, it should be a proud moment for all of us, because, there was a period of time and we were not able to provide mental health supports to our local jails. So that was very happy to see. The other last thing I wanted to mention is around the direct care wage increase that Governor Whitmer announced. It's a $2 an hour increase for all direct care workers. We have been working with the state of Michigan. It is for the months of April, May, and June. We've been working on the process for the implementation of that and around the funding, because this is a pretty significant cost to the system, and making sure that there is legislative support to push out that $2 an hour increase. I think that was it. That is it for my update. Are there any questions of any of the commissioners?
Thank you so much, Mary Beth. I did have just one quick question, and then Tony, I just saw your hand go up also. I'm just curious with social distancing going on in a lot of those group gathering places like the clubhouse, where a lot of people, tend to go to have people to be around, and that may be causing a ton of anxiety right now with those individuals. I'm curious if there's been any supplement or anything that we've been able to do to kind of help those individuals, or is it kind of up to the other services that are wrapped around those individuals to kind of fill that need at this time?
Well, it's a kind of a combination, Daniel. Both. So Lifeways is doing a lot relative to trying to put out some platforms and allowing individuals to be able to access for group support, if you will, so they can jump online and participate in a group meeting. But the providers themselves have been doing a lot to try to reach out to those individuals, because you are absolutely correct. Individuals who struggle with a mental illness, socialization is critical for healing and for health. And when they're not able and they're socially isolating, that can make a mental health issue and symptoms even more exacerbated. So they are doing everything they can to make sure that they're touching base with the people that they serve, whether it's a phone call or whether it's the use of a platform like Zoom, as much as possible. But social distancing is creating challenges.
Well, again, I thank you guys for the job that you're doing. On a different note, the only other question that I had for you was curious how the rest of the renovation on the building and working towards integration of mental health and physical health are going over at Lifeways.
Yeah. So right now, because the mental health services and the building renovations actually was considered an essential service, a lot of the construction was still occurring. A lot of the work was still happening. There were a couple of contractors that during that period of time when they were not able to work were not on site, but we still are on target for completing phase 1 by, I think it's the end of July. So we're still on target for that. There's a lot of work that's occurring for that. And, I think the biggest challenge, like many organizations that we're going to be faced with, is when we phase people back in. Right now, there's a big portion of the building where it's closed off, it's under construction. So people are kind of on top of each other. So right now, part of our phased in work is to look at the layout of the space and determine for those essential services for people, how do we bring those back online and keep more people that can still continue to work remotely, more of the administrative support type staff off-site so that they can have social distancing. Because I've got people right now, before all this transpired, where there's not 6 feet between them and their cubicles. So fun times, Daniel.
I can only imagine. I can only imagine. Tony, Commissioner Baer, you had a couple questions also?
Yes. Hi, Mary Beth.
Hi, Tony.
You mentioned the governor had put through a $2 an hour wage increase for some of your staff. Is that just during the shutdown or is that permanent?
No, it's not permanent. It is only for direct care workers. So it's for individuals in like group homes. It is not the staff here at Lifeways, but it's residential settings. And it's only for the months of April, May, and June at this point in time.
Okay. Was there state funding that went along with that, or is this another unfunded mandate?
Well, I haven't actually seen the funding yet, but we've been told that there is funding that's going to be coming. If there's not funding, it's going to be, let me just point out, for one service code in our region for 1 month is $5 million. It's huge. So.
Okay, that would bankrupt us. I think we need to make sure that the state does come through and provide funding to go along with this.
We've been doing that. We've been meeting with them weekly.
Okay, thank you.
Yep.
Are there any other questions for
Earl.
Mary Beth?
Mr. Chair, this is Earl.
Commissioner. Sorry, I was on mute.
Okay, thank you, Mr. Chair. I think Tony raises an excellent point here. I want to make sure now, Mary Beth, you just mentioned a rather shockingly large figure. That figure is not the $2 an hour. That is the total cost of whatever that service code is. Is that right?
So that 5 million that I gave a context, if you will, for one service code is for all 12 community mental health in our region, but that is for 1 month.
So I think Tony raises concern, and I would echo the concern of expending those funds for which appropriation has not yet been made at the state level to fund us. And we could be putting our legislators into a tight spot of being presented with a fait accompli that they have to fund because the money's been spent and the governor has attempted to shoehorn the legislature into spending money that she mandated. I think that is, I don't have a question here for you, Mary Beth. Sorry, I think it's just it's risky for us to expend those monies, not knowing whether appropriation may be made at the state level yet. Thank you, Mr. Chair.
Absolutely,
And I will
Ms.
just say I hear what you say, Commissioner Pulaski. It is a concern. We also have an obligation. We have a contract with Midstate Health Network, which is the PIHP, and they are going to be utilizing until they receive the funds from the state, current reserves that we have available to us. We've been struggling within some regions in the state in which direct care workers are not willing to come in and do the work. That whole hazard pay that's been mentioned before, this is trying to address that issue as well, just as an FYI.
Thank you. Well, I think it's definitely well deserved, but I agree that we definitely want to make sure we can figure out how it's going to be paid for. Is there any other questions? I'm trying to look to other screens. I don't see any. If there are, go ahead and chime in. Mary Beth, did you have anything else for us today?
Nope, that's it.
All right. Thank you so much. I think that will take care of us for you today. Thank you so much. All right. Okay. Now we are back on Department of Aging, March 2020 monthly report.
Okay, good afternoon, commissioners. Am I coming through okay? All right, thanks. I'm focusing on the May report. I'll just quickly review that all of our 8 senior nutrition sites, senior sites were closed starting March 16th. And because older adults are a vulnerable population for COVID-19, it's really undetermined when we can reopen. We have some information from other counties and the National Senior Center Association of ideas for programs, so for lack of a better term, programming for older adults who normally would congregate, for other options of things that we could do to support them. For our Meals on Wheels program, our participants went up sharply a couple weeks into the stay-at-home order. And part of that was because our older adults who normally would go to a congregate site, are staying home. So that increase, which is up by about 25%, has plateaued in the last couple weeks. It hasn't, it's not going up continually. It's kind of flattened out. And our meal drivers are delivering meals Monday, Wednesday, Friday. What we're doing is we switch to all frozen meals, so that we have the drivers out, fewer a cold supper meal and frozen meals for the weekend. But for now, it's all frozen meals, up to 14 meals a week, depending on the older person's preference. And then for our home care workers, when the stay-at-home order began March 25th, because we didn't have the personal protection equipment in the quantity that we needed, and just concerns for cross-contamination between homes, we have not been providing home care service, meaning lighthouse cleaning every other week, bathing assistance, and respite. We are taking steps starting in June to look at having home care workers begin again to provide service. If the stay-at-home order is still in place, the idea now is that a home care worker would go to one home each day instead of 3 or 4. So that way they go see the older adult, provide service with the gloves and the face mask. If they're assisting with a bath, they would wear a water-resistant gown so that they're not getting liquid on their clothes. And then they will be trained in how to properly dispose of the personal protection equipment. But then they would go home if there is still a stay-at-home order. Just again, to eliminate the possibility of taking contamination from one household to the next. So we're hoping we will do that in June, and that would affect 22 home care workers. And we did apply for a grant from the Jackson COVID Action Network, the JCAN, and I think Zoe Lyons talked about that at the study session. So we did receive a $3,000 grant from those donations, and that's to help us to pay for purchasing things that older adults need, primarily because they can't get out to do shopping like older adult depends. And one man, we're delivering frozen meals. He didn't have a microwave, so we purchased a microwave. Just incidentals, think that household supplies, cleaning supplies, that type of thing. So that's been helpful. And the other thing that our staff are doing, part of our disaster plan, is to call older adults who we've designated as what we call priority 1, meaning they don't have as much contact with family or friends. They're more isolated. So we have a staff person calling each of these individuals every week. There's about 85 who we've identified, and to talk with them, see how they're doing. Do they need anything? That's how we find out if there's an incidental item that they might need us to get for them. We connected one person with a volunteer who wants to do some friendly telephone visiting, those types of connections. And then the last item is that in May, began last week, May 4th, we do have 38 employees furloughed. The plan is for them to come back to work in June. But these are primarily then the home care workers. They were working with the nutrition staff to prepare meals, but now that's not happening because they are furloughed. Some of our social work staff are furloughed, but we do have a couple who are still working. They spend a couple days in the office and then a couple days working from home remotely, and that's working well because we still want to do an assessment. Excuse me. It's normally an in-home assessment. The assessment of need is now done over the phone, so staff are working on that. And are there any questions about what's happening during this interesting time of COVID-19?
Committee, any questions for Marcy today? Commissioner Kennedy?
And Marcy,
Hello.
I just see at the bottom that you're going to be retiring, huh?
Yes, that's my last comment. It's been a pleasure working for Jackson County for 30 some years. I've just really been blessed having as my vocation supporting older adults, and I really have enjoyed doing it on a government level and have appreciated commissioners' support over the years. And I will miss the work I do, but I know I'm leaving you all in good hands.
Okay, well, I just wanted to thank you and wish you a happy retirement.
Thank you. Thank you.
Any other comments, questions, concerns for Marcy today?
Mr. Chairman, if I may.
Mr. Shotwell?
Marcy, it's been a pleasure working with you over the last 18 years. I know there was a gap in there, but I really appreciate. I've talked to the gymnasium instructor at JCC this weekend, and he says he's got big plans for you.
Yes, that would be my loving husband. Thank you very much. I appreciate it.
That's right. Thank you again for everything you've done for us.
Thank you.
All right. Thank you, Chairman Shotwell. Okay, I'm looking for any other comments or questions for Marcy. And I would definitely echo those sentiments and wish you the best of luck in retirement.
Thank you.
All right. Thank you very much, Marcy. I think that takes care of us for today and brings us down to our next item that just disappeared off my screen. 2 seconds. Right, that brings us down to the Health Department monthly report.
Good afternoon, commissioners. This is Rashmi. Can you hear me okay?
Yes, we can.
Okay, I got the kiddos doing homework too, so my internet connection's not great. Okay, thank you for allowing me to report this afternoon. Just wanted to start off some non-COVID stuff for a change to give you an idea of some other activities going on at the health department. One is in regards to the furlough. We have approximately 10 individuals who've taken the furlough at this point. Others may be taking a reduction in hours at a future date. Some of the unknowns related to this is that we still don't know what's going on with our state contracts and some of our grants there. We've been told to just kind of continue on a status quo basis, but I haven't heard otherwise in terms of some of our state funded programs and our grant programs. The remaining staff that we do have continue to work on COVID-19 response efforts, support to those response activities, and also within their respective programs. As I just mentioned, they're working on state funded programs and grant funded programs to keep up with those requirements. On the WIC side, women, infants, and children, certainly this is a program that is a big need right now, particularly because individuals are experiencing hardships as well as unemployment. They're fully operating as far as, as much as we can, of course. We're not running our WIC clinics on site yet, and we're serving many new clients working remotely. Over the past 7 weeks, we've served approximately 200 additional clients as a result of the COVID economic impact. All aspects of the program have immediately transitioned to working remotely, extending benefits, and offering WIC services over the phone as much as possible. So for families that have had difficulty receiving benefit cards, which we have heard probably a lot to do with the US Postal Service, we are allowing people to drive up to our building, and we're going out to the parking lot and getting them their benefit cards. So we're not missing that gap. Under our Division of Personal Health and Preventative Health Services, most of the staff in there has diverted to COVID response efforts. There's still some that continue to work in other safety net areas and assisting with getting Medicaid Medicaid connections made. We've also had permission from the state to conduct telehealth or phone calls in a couple of our programs here. Since March 18th in Maternal Infant Health Program, that's our home visiting program, 101 telehealth visits were conducted. And then also since March 18th, 52 plans of care were developed over the phone for clients in our Children's Special Healthcare Services program. And I'll remind you that our Children's Special Healthcare Services program is the one for covers over 1,000 diagnoses for children with developmental delays, physical disabilities, medical issues, physical issues, things like that. On the environmental health side, we've begun to plan for an increased workload in anticipation of the new residential home construction being allowed to start up again as of May 7th. We did open up part of our facility, of course, doing that safely with maintaining 6 feet of distance, wearing masks, things like that. That's so that we can allow realtors, people who are opening up new sites, things like that, have access to us, fill out the appropriate paperwork, and pay the fees accordingly. As far as our permitting, only for those with repair systems, as I mentioned, and those with issues. So we do understand, especially on the construction side, there'll be a pent-up demand as far as stuff that's been on delay, and those would be starting up again. So we're gearing up for those on the environmental health side. On the food side, the Environmental Health Division sent the 2021 food establishment license renewal packages out this week to about 450 restaurant owners, nonprofit facilities, and transitory food operating proprietors. A letter detailing the Board of Commissioners' decision to delay the due date for renewal to August 31st with an additional installment plan option for that date was included in this mailing. So thank you for being able to help us outline those options. It is expected that most licensees will pay their fees by the new due date, but they'll have the option to pay up through the end of the year, which would be a welcome relief, especially for some of these business owners experiencing hardships right now. We had a new staff person start on the Type 2 water systems. She's our Type 2 water supply coordinator. She'll become fully certified in soil erosion sedimentation control, and staff will be bringing her up to speed, and we're confident that she'll be able to meet that challenge. So that on my final part of my report, I'll go through our COVID-19 responses. Our numbers have changed since I submitted this report, so I'll give you the numbers I have as of this morning. In our county, we have 399 positives. 185 of those are male, 214 are female, and we have 25 deaths. On the state side, we have 47,138 positives and 4,351 deaths. I know that many of you had asked me at our last study session meeting about those that are recovered. That's a tricky number to report. I'll say the state defines those that are recovered or cleared out, if you will, as those who've been non-symptomatic for 30 days from the onset of their symptoms or when we got a referral date. The tricky part about that is the Free Press just issued an article that talked about how even though individuals might be recovered by that definition, they might be dealing with ancillary things associated. So they're technically not officially cleared out. So that number is a little bit tricky to get at. And I'll continue to work with our medical director and nursing staff on how to be able to report that figure in the future. And then let's see, as far as the prison, I don't think I included a lot of detail, but I found some detail this morning in my meeting with the hospital. They are continuing to do mass testing, meaning they're testing also asymptomatic prisoners. They're also trying to do serology testing as a backup. Now, if you recall, serology testing is not intended to be a diagnosis test. However, it can be utilized as a backup that they're trying to do that. So that'll come with time. I think that as far as my other pieces on this, we continue to work through contact tracing with our nursing staff, and we've identified about 791 individuals that are considered probable, suspect, or potential cases in our county. So those might be individuals, say someone is positive and they have about 50 individuals that are associated with them. So we count those individuals as well. So some of these may also include individuals residing in other counties, and we're working through those appropriately. We find a lot that people may live in Jackson, but they work, say, at Kellogg or a different establishment. So they work in another county. So we work closely with that county to identify their coworkers as well. We've developed a nice communication piece, a business toolkit, if you will, to understand the parameters and processes that should be in place prior to reopening. We're working with our Human Resources Department to develop a similar toolkit for county departments, and that we hope to roll out fairly soon. We've been working with nursing homes, assisted living, and independent living to provide infection control measures and community mitigation strategies for those facilities. We also work with Henry Ford in order to assure that testing can occur in those facilities as quickly as we can, so we can identify positives and take action appropriately. Letter to notify those facilities I mentioned just recently, to notify them of testing resources, PPE resources, and infection control resources. So they have information that they can contact us or the hospital, depending on what they need. We continue to maintain a strong presence and partnership with the JCAN, Jackson COVID-19 Action Network, as a liaison and meeting the needs of that community, looking at things such as access to food, shelter, information, and other basic needs during this crisis. So we also continue to encourage social distancing practices, washing hands, reporting of illnesses and symptoms to the county, to the health department, and working with the county residents. Can I take any questions at this time?
Committee, are there any questions for Rashmi today? Rashmi, I did have a couple while people are kind of pondering. I don't know if anybody else has any questions. There was an issue with getting us inspections scheduled that we talked about, and we can for the most part take it offline. I just was curious if you can, when you get a moment, just follow up on that particular citizen's situation. They contacted me, and I don't know if they're having more issues or something, but they have still not gotten that resolved, and they called me about it the other day. So that was one thing. The second thing is, of course, just thank you for the tremendous job that you're doing at the head of this COVID-19 situation in our county and keeping us all updated and informed. I'm curious for that business toolkit. Where can individuals find that or access that information?
Sure. Thank you, Commissioner Mahoney. I will get with you in terms of an email so it gets to the top of my inbox on this construction site. Related to construction as well, Don just texted me, our EH director, and told me that we are issuing permits for new sites. So we're getting that up and going, which is good to hear. On the business toolkit, just finalized that over the weekend, and we are planning to roll that out to Chamber. Our manufacturing association, Enterprise Group is another, working with manufacturing groups. We also plan to share it with Henry Ford, Allegiance Health, Occupational Health, and then we'll be rolling out to our department heads as well. It'll be on our website, Commissioner Mahoney, as a PDF, and then we can also send to businesses as a link. That way they can link to their website. So I think that covers a lot of the areas in terms of business.
Yeah, absolutely. Thank you so much.
Sure.
Okay. I think that answered all of my questions. Commissioners, were there any other questions for Rashmi? I don't see any. Okay, thank you so much, Rashmi. I think we are all set. Thank you again so much.
Thank you. Have a good afternoon. Bye-bye.
All right, next item is we need a motion and second to pay the claims. All right, Commissioner Williams and Commissioner Baird, thank you very much. All in favor, say aye or show of hand. All right, all opposed, the same. All right, and next item is going to be other minutes. I don't see any other minutes listed. For June reporting, we have Department on Aging, Health Department, and Lifeways for June reporting. That brings us down to public comments. Michelle, did we have any closing public comments?
There's no public comment.
All right, thank you very much. And committee members. All right, seeing or hearing none, I think that concludes the Human Services meeting for today. Thank you very much, everybody. Have a good day and good week. Talk to you guys all soon.